Dr. Tedros, a few weeks ago, you had said that America was doing a great job in fighting the coronavirus. On Thursday, President Trump said that he asked whether or not injecting disinfectants into the body would help kill it. There are states that are reopening reopening services, even though there's no contact tracing in virtually any state in the United States, and we're about to hit 1 million cases. Can you tell me if you still think the United States is doing a great job? And if so, what is it that the U.S. is doing well? And what is it that we're not doing so well?
Thank you very much for this question.
Thank you. I think the United States is dealing, as it has been for a while, with what is a complex situation. This is a very large country with 50 states, each one with different populations, with different levels of urbanization, and the epidemic at different levels of development and evolution in each of those. I believe the federal government and the system of governors are working together to move America and its people through this very difficult situation, with public health and other scientific leaders adding and inputting their advice into the system. And as such, as the DG just said, WHO advises our member states on what we believe to be rational policies, but governments themselves, and especially in the United States with its superb public health, science and policy infrastructure, is well positioned to manage its own transition from the public health and social measures, and has to balance, as I've said before, the health issues associated with COVID and the lives and livelihood issues. What we can say is that it's important. I think there is a national plan. I think it has been very clearly laid out, a phased plan for a stepwise reduction in public health and social measures. That plan is driven by certain parameters of data, like I mentioned before, downward trajectory of cases, the availability of capacity in the health system, and many others, as Maria said. It's a multifaceted decision-making process, and that framework exists. And obviously, if that framework is being advised by top scientists at a federal level, then obviously it is a discussion with the state system as how best to introduce that. But we believe that the overarching federal plan seems to be very much based on science, and to the extent possible, and with all of the adaptations that are needed as we move forward, we hope that the US government and its people can move through that plan, work through day to day how to do that, and will find a successful solution that reduces the impact on people's lives and also on their livelihoods.